I almost get nervous describing it because I don't know what other people can handle. There are so many sick patients who require that level of care that we were just like sardines cramming patients into rooms. Each of these patients has a tube down their throat. You are just chasing death at all times.
Doctors dealing with a crush of coronavirus patients.
I'm seeing patients that have been here since the beginning of the pandemic. We've had patients who are now on day 60 plus with the infection.
Laura Bloom and Ronald E. Catchy are residents at Rutgers University Hospital in Newark, New Jersey.
It required a unified effort, and it still does.
It's not over.
No, it's absolutely not over.
As coronavirus cases surged, they were on the front lines. Now, after the physical and mental stress of fighting a pandemic, they're also facing financial stress.
We will be receiving a salary cut.
In June, Rutgers declared a fiscal emergency, projecting a $260 million negative change in fund operations because of coronavirus. The university froze wages for 20,000 employees, including medical residents who are treating COVID patients.
Residents are notoriously underpaid and overworked. What's your hourly wage?
I take home just under $1,700 every 2 weeks. So when you divide that by the 80 hours per week, it works out to $10.61 an hour.
You're making $10 an hour as a resident doctor.
Yes, ma'am.
Ron, what do you make an hour?
At this rate, I'll anticipate earning $8.56.
In response, Rutgers says its fiscal emergency led to the postponement of scheduled wage increases. According to the university, that wage freeze is allowed by the labor contract it has with its residents. Senior administrators will also be taking a 5 to 10% pay cut. Rutgers also told us beginning next week, residents will receive supplemental pay for their efforts fighting the pandemic. Before this, they were not receiving hazard pay. This isn't the only place doctor pay is being impacted. According to a study from Merritt Hawkins and the Physicians Foundation, 18% of doctors treating COVID patients in the U.S. have been furloughed or received a pay cut during this pandemic.
I think hospitals across the board, they have to maintain a certain amount of money, and nonprofits do as well. And when there was a shutdown, they saw a huge decrease in revenue, and they're going to respond the way a lot of businesses respond, by cutting hours and letting people go. The people on the front lines, they are going through some of the most difficult clinical times with patients that they've ever had, and many of them are embarking on territory they never thought they would embark on. They're doing what they love to do, but they're being asked to do it on steroids, and it's exceedingly difficult.
Now, Rutgers did declare a financial emergency, and a lot of hospitals are saying, hey, we're also in a crisis right now financially because of this. What do you say to that?
Through these open book conversations that we've had with Rutgers, where we get to actually see their financials, we know that they have $583.1 million in true unrestricted funds. These are liquid assets that the university can use at its discretion. They could build another fine arts institution, another parking ward, or they could use it to make sure that their employees didn't have to take salary cuts or get laid off.
In a statement, Rutgers says it is now drawing upon its reserve funds and will use them in 2021 as well.
We aren't asking for anything extraordinary. We're asking for the money that is in our contract. That's a fair wage. We've been all putting our lives on the line, so it's extremely demoralizing to feel that the institution for whom we work doesn't support us.
We're here to be doctors. We're here to care for patients. And I think the last thing we want to talk about is how much we're getting paid. This is a slap in the face.
Migrant farm workers in Florida among the surging numbers of coronavirus patients in the state. MSNBC correspondent Tremaine Lee is the host of the NBC podcast Into America. Tremaine, in your latest podcast, you take us into a rural community in Florida that is home to thousands of migrant farm workers and the highest number of coronavirus cases in the state. What have you learned? What is going on there?
I'll tell you, as the numbers are rising in Florida, they're surging in places like Immokalee with thousands and thousands of migrant farm workers. They call it the tomato capital, and so it requires a lot of work. But you think about a lot of these workers are crammed together in close quarters to live, to save rent. Then they crowd onto buses, 40 and 50 at a time, to get to fields that are also crowded. And so what we've seen is an outbreak that some could assume would be expected, but one that these workers and those that advocate on their behalf have been fearing all along, Allison.
Tremaine, the coalition of Immokalee workers and dozens of other organizations wrote a letter to Governor Ron DeSantis outlining their concerns. What did that letter say, and how is the governor responding to them?
Yeah, what the organizations were hoping for was, one, testing. They wanted access to greater testing. But they also asked for a field hospital or somewhere where they could be tested on site, because the closest hospital is 40 minutes away. I mean, think about communities like this that are already vulnerable. They're not very, don't have very firm economic footing. It's hard for them to get transportation out there. But they also wanted contact tracing. So this is in an area that's in Collier County. So they're in a more rural area, farming area, but they also have Naples and Marco Island. They just wanted some access. But let's take a listen to exactly what they had to say right here.
And you see the response from Governor Ron DeSantis saying that, well, it's only in farm worker communities. And he even went as far as to say, you don't want to be mixing those people with the general public if there is an outbreak. When you hear things like that, that basically it's embracing the idea that it is okay to let farm workers alone without resources, and basically if they die, it's kind of accepted. We cannot accept something like that as a community, but beyond that, the country shouldn't allow. The people that place the food on the table of every family deserves better.
Those people, Allison, who do so much work to provide essential business, let's not forget that they were deemed essential back in March, do so much, but not only do they want the respect as humans, they want to be kept safe as much as possible.
It seems like the least we could do for them. Tremaine, am I correct that that letter was written almost 3 months ago? And have any of their concerns been met? Because it sure doesn't sound like it.
3 months ago, when we talked to the folks over at Immokalee, they say no. The governor has not only dragged his feet, but politicized and weaponized the situation down there. What has changed is they now have the highest number of COVID patients in all of Florida, that zip code. But you talk to the state, they say, we tried to offer testing first to them, and there was some space made to isolate. But on the ground, it feels like a completely different situation, Allison.
Oh, my goodness, Tremaine. How about the federal government? I mean, what role does it play here? And can they get any sort of help on the federal level?
Well, as I mentioned a few minutes ago, these workers were deemed essential early March, but they weren't afforded any protections at all. And so as President Trump kind of pushed the responsibility to the states, many states like Florida seemed ill-equipped or unwilling to really help as much as they can. And so even though they said they've, tried to help, the folks down there feel left high and dry. So it seems to be passing the buck from the federal to the state, and now the state is just blaming these workers for the increased numbers and the surge, meanwhile not offering any protection to them at all.
Just an unbelievable story, Tremaine. Yet another really important podcast. Thanks so much for taking us into America again.
Thank you, Allison.
Dr. Anthony Fauci says the country is heading in the wrong direction and that no state is safe.
When you have an outbreak in one part of the country, even though in other parts of the country they're doing well, they are vulnerable. I made that point very clearly last week at a press conference. We can't just focus on those areas that are having the surge. It puts the entire country at risk.
NBC News medical contributor Dr. Vin Gupta joins me now. Dr. Gupta, let's talk about what Dr. Fauci said there. Even states that locked down early on and flattened the curve are at risk as cases spike in other parts of the country. What can we possibly do about that?
There's not much we can do, unfortunately. What we need a national approach, Allison. We haven't had that. You know that very well since the beginning of February, when we first had the incident case here in Washington State. we've been lacking a national strategy. You can't have regional strategies. You can't have 50 different approaches. You have to have one consistent approach within borders. And that means we need to enforce wearing masks, not just recommending it. And if you don't wear it, you're going to get fined. That's what we need to hear the president and the vice president say. That's what we need to see them model when they're in front of a bully pulpit. The press secretary is just at a podium. She could have worn a mask. She chooses not to. So modeling behavior is important. But then this also comes down to just understanding how the science is evolving. We know indoor transmission is far likelier than outdoor transmission, to the tune of 19 times more likely, Allison. So what does that mean? That means that, unfortunately, indoor restaurants, other indoor type events, large gathering events like political rallies, like singing choirs, such as the one that the vice president enjoyed in person just a few days ago, those types of events, in addition to indoor dining, have to be curtailed nationwide for us to hope to break outbreak transmission nationwide. This can't be a zip code approach or a county approach. It has to be a national approach.
We have some viewer questions for you, and I want to skip right ahead to one that is particularly about something you just brought up, this indoor versus outdoor dining. As we know, New Jersey and New York City will not reopen indoor dining just yet. A viewer wants to know, if indoor dining is not safe, is outdoor dining in public safe if diners still have to take their masks off to eat?
It's safer. Is it better to eat at home? Yeah, okay. Eat a home-cooked meal than going outdoor dining? Yeah, absolutely, but it's certainly safer.
How about the 4th of July? It's this weekend. Lots of Americans would typically celebrate with cookouts. How safe is it to go somewhere that food is being shared or food is being served that you didn't prepare yourself?
You're taking a risk. You know, right now, I would say, and I get this question a lot, what are the things that we should not be doing? Right now, unfortunately, we're in the middle of a pandemic that's poorly controlled because of feckless leadership. Now's not the time for barbecues with outside of family members or those that you've been socially distancing with. So right now, my advice would be do not engage in large gatherings, indoor or out. If you have to go out for a meal, because we all enjoy going out for a meal, I get it. Do it outdoors. Do not do indoor dining. That should be banned for the time being. And those are the guardrails by which I would suggest we all live by. Mandating masks in public, that should be any elected leader that's watching this. If you're not doing that, you're letting down your people and the people that voted you into office. So that mandating masks, if your leaders are not going to tell you to do it or enforce it, you should do it to protect yourself and the health of your children and your loved ones.
One last question for you about best practices, because I think people are still wondering so much about what is it okay to do, especially as the weather gets warmer. People want to be outside. They don't want to be cooped up indoors looking at the sunshine outside. What are some examples of smart things, best practices, things you would say, hey, if you've got to go out with the folks in your home, this is a good way to do it, a smart thing to do that might not put you in as much of a risk position as, for example, eating inside or going to a restaurant or those kinds of things?
Also, it's a great question. And so the things that we normally like to do and enjoy outside, you should do. Just do it in places that are less dense. Running is totally fine. Cycling is excellent. If you're a biker or if you have a bike, go for a bike ride this weekend. That's something that's great to do. Walks by the beach. Again, it's part of this is we know transmission outdoors is far less than indoors. So if you're wearing a mask, if you're outdoors by the beach, if you're maintaining some degree of social distancing, that coupled with the air and aerodynamics will drastically minimize transmission relative to indoors where you don't have the benefit of aerodynamics to move things around. So really most activities that you would otherwise want to enjoy at this time of the year are safe. We have to be mindful of individual space and wear a mask. But then you should be able to still, hopefully take walks by the beach, if not literally lay out on the beach itself. So within the guardrails that have been stipulated in your locality, it's okay to be outside and engage in aerobic activity. That's actually a really great protective thing you can do to stave off infection.
Dr. Gupta, thank you so much for answering these questions. As someone in the news who is talking about this all day long, I still second guess the decisions I'm making every day because this is new territory for all of us, and we're just not sure sometimes right versus wrong. Thank you so much for your medical expertise and for being with us again.
Thank you.
Arizona hitting a sobering record today, nearly 5,000 new cases in just the last 24 hours and a record number of hospitalizations. All of this happening while Vice President Pence visits the state. NBC News political reporter Vaughn Hilliard is in Phoenix. And Vaughn, let's talk about what kind of a situation the Vice President flew into today.
Allison, the Vice President flew in to Arizona as a record number of hospitalizations were recorded, a record number of cases, more than 4,800, and 88 more Arizonans were reported to have died. This is a crisis here in Arizona, and the numbers have suggested that for a month and a half now, more than a month and a half. The president actually came out to the state on May 5th, and on May 5th, I did a news report with you, and at that time told you that there was a record number of cases and a record number of deaths. Fast forward 2 months, we're here and we're saying the same tune, but you have seen those numbers absolutely exponentially skyrocket to a point where the crisis network of care, crisis system of care has been implemented here at Arizona hospitals, which allows hospitals to begin treating patients based on essentially need. Triage, determining with the limited resources the best patients that have the best shot of living long term. This is what the Vice President flew in here today, was a dire situation in which there is a lack of understanding of the extent to which the virus is spread here, but also the extent to which this hospital system is going to be able to bear the brunt of it.
Vaughn, I know day after day you've been asking the governor, asking all sorts of officials questions about steps they're taking to slow the spread here. Any new restrictions? Anything new today on that front?
I talked to Arizona Department of Health Services Director Kara Christ, and she stopped and talked with me right before going to that briefing, and I said, what is it going to take to implement a stay-at-home order? And she told me that right now this is a targeted approach and that there are consequences to isolating folks at home, which there are, of course. But the question is, can the spread stop without such forceful action as a stay-at-home order? The Vice President was asked about that, and he pushed the question aside, suggesting that this governor was doing what he could in his targeted efforts in those executive orders on Monday, in which he closed gymnasiums and closed movie theaters and closed bars, but restaurants are still open, retail are still open, malls are still open. You see life still very much as normal here in the state, Allison, at a time in which these numbers are far from appearing to go in any direction but up.
Vaughn, the Vice President has said that reopening too quickly is not what's causing spikes in places like Arizona. How does that track with what local health officials are saying and the data that you're seeing there in Arizona?
It doesn't track with the data. The Vice President made those comments last night at a coronavirus task force briefing, suggesting that the reopenings of Texas, Florida, and Arizona weren't the direct correlation with the rise of numbers. But if you look at the data, let's just look at the percent positive cases. The stay-at-home order in Texas lifted on April 30th. About 2 weeks later, that percent positive number started to go up. Look over to Florida, the beginning of May. Stay-at-home order lifted 2 weeks later after that incubation period. The percent positive numbers started to go up. Here in Arizona, it was early May when restaurants opened, retail opened. The stay-at-home order expired May 15th. That's when the numbers started to go up. There was a rosy picture painted yet again by this Vice President, who we should note urged folks to take this seriously, wear a mask, socially distant, and wash their hands. At the same time, the Vice President was painting a much rosier picture that when asked about hospitalization capacity here, he said, quote, they have capacity. Well, what does that mean? You've got a couple hospitals here and there. Patients have already had to be transferred because there are certain hospitals that have already hit capacity. Down in Yuma, there's the Yuma Regional Medical Center. They have had to consistently send patients to Tucson because they don't have the staff personnel in the bed capacity in order to treat those patients. So if you look at a percentage, sure, there's a few beds around the state, but what you just saw here is a 28% test% positive rate now in the state, which means here the exposure rate is only going to continue to increase, and those hospitalizations are only going to continue to increase at least over the next 2 weeks, Allison. What we just heard in terms of this rosy picture, or perhaps not a rosy picture, but trying to paint this as not as bad of a dire situation as it is, just doesn't match with the data and what we're hearing from healthcare professionals in the hospitals here in the state.
Vaughn, Vice President Pence was planning a campaign event in Tucson, but decided against it. Did he say why?
The vice president did iterate the message here today to wear masks. On Sunday, you heard him say the quote for the first time, quote, wear a mask. Today, President Trump also for the first time urged people to wear a mask. It was just 8 days ago when we talked with you 15 miles north of here at that church where more than 3,000 folks gathering with almost not a soul wearing a mask. The vice president, I can tell you, in terms of reporting, decided to cancel the event as these numbers surge. There is still no explanation as for why the president held an event with maskless individuals just 1 week ago. But the reality is that that is the decision that was made by this vice president's office. And it's just a big question mark about where this state is headed and where the trajectory is here right now, Allison.
All right, Vaughn Hilliard in Arizona. Thanks so much, my friend.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.